Greetings from Advanced Fertility and Gynecology Center. I'm Dr. Kaberi Banerjee, and today we shall have a discussion on IVF in women more than 40 years of age. So, as we all know, that infertility is increasing, and more and more women are coming for treatment in the later part of 30s and moving on to 40s. So, today we shall be discussing a few points regarding these women and their treatment. So, what is the reason for wanting fertility treatment in your 40s? Now, late marriage, unable to find the right partner, being involved in a career are some of the reasons. 40 for a man is just the beginning of a good life and with no negative effect on his reproductive potential. But unfortunately for the woman, it becomes difficult to attain pregnancy around this age. Even women who've gotten married earlier may decide to withhold pregnancy for the same reasons as we discussed above. Many women suffer from infertility in the early part of their 30s, but undergo various kinds of medical treatment and are either not advised IVF or when they are advised, refrain from going ahead for their own personal reasons. So these are the various reasons why women at or around 40 come to us for treatment. Now it's very clear that we do not want women who come to us for treatment to be suffering from any guilt feelings. I'm sure most of the women who come to us do not have any guilt feelings, but even if you do, I think it is worthwhile not to have these guilt feelings. The reason being that you need to go ahead with this treatment with the right frame of mind. And for whatever reason you were not able to have your treatment, this is the right time. Say to yourself that today is my right time, and please do not go ahead with the treatment with any guilt feelings in your head as to, I should have come earlier. Why did I wait so long? Just come with a positive frame of mind, and that's so very important. Another caution is the internet. It gives us a lot of information, it keeps you well informed. You know the pros and cons of various things that you want to know about, but you need to sieve the information that you are getting. Everything out there is not for you. Everything that has, if you type IVF in 40s, whatever comes down there, everything is not for you. Everyone is different. So, what has worked for one woman may not exactly work for you. Every body is different. You not only have your eggs, you have the sperm, you have the uterus. Uh, People have different egg potentials regardless of the same age. So, everyone is different. Also, please don't keep on checking and rechecking on the internet, on your phone, and that kind of increases the anxiety level, the levels of your doubt, and overall puts in a negative system in your body that may not be conducive for pregnancy. So it's very important to stay in a positive, affirmative, happy state of mind. In the news, on the tabloids, you have many celebrities having babies beyond 40 years of age, and everybody wonders if she had it, then why not me? What they underwent, how they underwent, is their story and is usually not for public consumption. So we must leave those aside and just focus on you and your treatment. Also, whilst you are coming for treatment around this age, anti-Mullerian hormone is a very important blood test that checks your fertility level. And where are you on this dial? Are you way down in less than one, or you are more than two? Kind of gives you a good idea as to what is your overall chance. But you need to be aware that if you have a low AMH that is less than one, yes, it could be that your egg reserve are getting low, but it could also be that maybe you were on prolonged birth control pill just a few months ago. Previous birth control pill consumption has no effect on AMH level, but recent prolonged there are certain injections, GnRH agonist injections can reduce AMH levels. Endometriosis per se can reduce. Surgery of the ovaries can reduce AMH levels. Of course, with endometriosis and with surgery, your AMH levels have gone down and they cannot be brought up as much as when it is low with gone down with ingestion of drugs. Pregnancy also can have a low AMH level. So if you have been having long period episodes of no periods, it's always a good idea to do the pregnancy test, especially when the AMH levels are low. Know your fertility pyramid. What it means that you would have read or heard friends with 7 eggs, uh, 5 embryos, or 10 embryos of blastocysts. So it is specific for each person depending on their age, their AMH levels, their response to stimulation. And around 40, if you get something like this, like getting 5 follicles after stimulation, 4 eggs retrieved, out of which 3 are mature, 3 have fertilized, you have 2 get embryos, and if 1 is implanted, it's like fantastic. But it can be the other way too. You may just have 2 follicles and no good embryos, or you could have 10 follicles and 4 good embryos. So everybody's fertility pyramid is different, and especially around 40, the numbers go much lower than what it would have been in the 30s or 20s. So you have kind of made up your mind that it's time to go ahead with IVF. Now, there's a right here. It's not that you need IVF all the time. In 40s, people do conceive naturally. People do conceive with IUI. But especially if you've tried for a while, your AMH levels are low, there is absolutely no point in waiting longer. You must proceed with IVF treatment if you are keen to give your eggs a shot. So you see your doctor, she will discuss AMH levels. Sometimes it's also important to get FSH levels. AMH can be done anytime in the menstrual cycles, FSH in the first or second day of the period. This is done when you have abnormally low AMH and you want to rule out hypogonadotrophic hypogonadism, which usually would have been picked if you've reached 40. Your doctor will do a good ultrasound of the ovaries, your uterus. You will have a good discussion of the realistic chances of pregnancy at this age, which is usually not more than 15% per attempt. And please have this good discussion to avoid unnecessary anger and disappointment later. And then, before you start off with your injections, it's important that your body is ready, it's detox. Usually, you should be following this lifestyle, say forever. But yes, it's not possible because of your work or other exigencies. So, at least for 1 to 2 months, if you've not already been doing this, give yourself some good diet, a lot of green leafy vegetables, a lot of fruits. Raw food is very good. Exercises, walking, yoga, meditation, mindfulness. Of course, smoking and alcohol are a big no no. Smoking definitely reduces your egg reserve. So, even if you have younger friends who are obviously wanting family later, you need to pass on this information to them. And you need to know exactly how the steps are going to be and know where things can go well, know where things can go wrong, so that the overall experience of your IVF cycle is at least you know what to expect. Then you have folic acids, multivitamins, uh, zinc, vitamin D levels must be okay. Fish oil, certain studies, omega 3 fatty acids have been known to improve egg reserve or egg quality. Coenzyme Q is also another such molecule. So it may be a good idea to be on these vitamins. Uh, there have there are certain drugs that may increase the number of eggs uh, if you've been taking them for a cycle or so, a month or so before the injection starts. So DHEA, dehydroepiandrosterone, testosterone gel, growth hormone during your stimulation, estrogen tablets before you start your stimulations may be started by your doctor. At our center, we do start DHEA. We give testosterone gel for some patients, and we do give luteal phase estrogen for improving the egg reserve. Of course, it's not all about you. The embryo is 50% yours and 50% your partner's. So he has to give in as much as you are into it. He needs to have a good diet, raw vegetables, fruits, good exercise, no to smoking, alcohol, zinc supplements, L-carnitine supplements, and all this to improve the sperm quality, quantity. Your doctor may want to do a DNA fragmentation if the count, etc., is on the lower side. So just prepare your partner as well as you are preparing yourself. The focus should not shift from either. Now, there are various ways to stimulate the ovaries. You have an agonist protocol, which starts from the first or second day of the period. That's the antagonist. The agonist starts from day 21. There's dual stimulation. You give 2 cycles of stimulation in the same menstrual cycle. So you start on day 1, day 2, you pick up eggs on 14, you start again stimulation on 16, you pick up eggs on day 22, so or 28. These are newer stimulation protocols, minimal stimulation, stimulation for 2, 3 cycles, pulling the embryos and transferring the best ones. So we decide depending on the patient profile, the various blood parameters, response to injection as to which protocol is good for the other. Okay, so consider surrogacy. Now, consider surrogacy is discussed here because it may kind of be the last option for getting a baby with your own eggs if transferring into your uterus numerous times have led to failure. Now, this is not for everybody, but it may be discussed with your doctor. Does your doctor really think that this one or two embryos may thrive better in a younger, healthier uterus? So it's something that you need to consider or just talk about. Sometimes it works and sometimes it doesn't. There's also a lot of information about pre-implantation genetic screening, endometrium receptivity tests. We do not offer these at 40 years of age. We feel they do not improve pregnancy rates, they increase cycle costs. We would rather do another cycle than invest in these options. But, you know, there's a lot of contradictory data out there, and definitely internet does not do justice to the various scientific discussions that really matter in these add-ons during IVF. So you've tried, many of you, so it's 15% per trial at best, so maybe 30%, so 1 in 3 would be there in 2 to 3 attempts, and more than 50% would not be there in 2 to 3 attempts, but some would, many wouldn't. So, in your mind, before you start, you need to have this conversation with yourself, with your partner, with your doctor, as to how many trials you would like to give and when you would like to stop. And it's very good if you do it in the beginning, so that though it may be very, very difficult, at least emotionally, you know that these are your, landmarks or deadlines, and that's it really. You've done your bit. And we hope that in this journey, you will get where you want to be. But yes, the discussion for all the options, including egg donor, must be there right in the beginning. The options must be discussed. So thank you very much, and I hope you found it useful. We will be coming to you with more information about IVF and in women uh, who have had failed IVF cycles, difficult implantation, miscarriages. So all the best to you, and do keep in touch with us. Thank you.